Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Joel Nerem. He's a veterinarian at the Pipestone Veterinary Clinic in Minnesota. Great to see you, Joel.
Thanks for having me.
We're going to talk about a complicated subject today. We'll try to make it simple, and that's antimicrobial resistance. You and your colleagues are trying to take this to the field and see what it really means on the farm. What exactly are you doing?
Sure. Well, obviously antimicrobial resistance is a pretty important topic. It's particularly a topic of interest today with CDC and others publishing that up to 23,000 people may die each year because of antibiotic resistant infections. And so that discussion has spilled over into agriculture because we use antibiotics, particularly in pig farming, but in all livestock species, to treat bacterial infections and to improve the health of the animals that are in our care. And so as a veterinarian, I'm concerned about antibiotic resistance both in treating my patients, pigs in this case, but also obviously as a member of society, I'm concerned about antibiotic resistance when it comes to being able to treat infections of human beings. And so we have taken on this topic because of the interest that society has, because we're concerned about those things and wanting to make sure that what we're doing as veterinary practitioners is not harming our ability to treat human beings with resistant infections. We realized that we had our own data set on antibiotic susceptibility and resistance through the case submissions that our veterinary team had been making over the last 15 to 20 years. We have data for the last 18 years at 3 of the major veterinary diagnostic laboratories that we work with, and we have about 4,500 cases of infections or caused by one of 5 major swine bacterial pathogens: Strep suis, Haemophilus parasuis, Actinobacillus suis, E. coli, and Salmonella. And so we decided to look at those cases and look at the relative level of susceptibility or resistance for each of those cases and track that over time. And we simply assigned a value of 0 for a susceptible bacteria to a particular antibiotic and a value of 1 for one that's resistant to create an index. And so that index ranges from 0 to 1, as you might imagine. We track that over a period of about 17 years, and what we're finding is a pretty flat line. So that's good news, and it matches really what our clinical observations have been in general. We're not typically finding an increase in cases of resistant swine pathogens of the 5 that I mentioned. And so, yeah, clinical observation seems to match the data, at least in the way we've analyzed it to date.
So it sounds like this is consistent with the pork industry's pretty good track record of using antibiotics responsibly.
I think that the pork industry in general, pig farmers in general, have been very proactive in making sure that we're using the tools we have available in a responsible manner and making sure that we're providing a safe and wholesome product for the consumer. We're making a very intentional effort, particularly with the concern of society about antibiotics as a tool, to make sure that we're always emphasizing responsible antibiotic use. It's not that that hasn't been a priority, but it's something that we are emphasizing more and more today, making that sort of top of mind for sure. In that, we're also looking for non-antibiotic type tools to better promote the health of pigs. And so we're big proponents of preventative vaccination. We're big proponents of the right management techniques to more effectively raise pigs in a healthy environment. We're all about disease elimination. So there's a lot of things that we can do to better optimize pig health and performance that doesn't rely on antibiotics and that really promotes overall health in general. Typically, when a veterinarian gets called to a pig farm, the first thing that they do is they employ their clinical skills to evaluate based on the age of the pig and the clinical signs and the number of animals that are displaying those signs, and then potentially a necropsy, what's actually happening. And based on those observations and putting all of that information together, a clinical diagnosis will be made. And we'll oftentimes have to, if it's deemed necessary, prescribe antibiotics. Samples then are collected at that same time and submitted to a diagnostic lab. And it usually takes a couple of days in order to get a culture and then a sensitivity result back to us. And by about that time, we're getting some impression on the effectiveness of the treatment that we've prescribed.
Now, some people have taken a look at antibiotic volume and try to use that as a metric to try to get a handle on responsible use or even resistance. What sort of metrics are you using at Pipestone?
We should know how we're using the drugs we're using on farm, and we should keep a record of that. It's pretty hard to convince someone you're being responsible with antibiotics if you don't know how much antibiotics you're using. And so we're all about promoting good record keeping and benchmarking year over year our antibiotic use that is necessary through the interaction of a veterinary client-patient relationship. We don't believe in arbitrary reductions in antibiotic use, and that's in Europe that has been employed, I think, as a primary means of addressing society's concern about antibiotic resistance. We think that arbitrary reductions in antibiotics at the farm level are not necessarily the most prudent way to approach it because it might not be the best thing for the pig and the pig's health, and it might not be the best thing for society as it relates to food safety, et cetera, et cetera. Our approach has been more about let's focus on all of the tools we have to manage pig health, antibiotics being necessary to treat in bacterial infections, and move forward in a way that we can track antibiotic use over time and hopefully see the right trends.
Now, there was a report that came out of FDA last year that showed significant drops in the use of feed antibiotics, but then there was actually a spike in injectable. What does that tell you?
I think that producers or farmers today are looking at different ways of delivering antibiotics. I think the reduction in the feed antibiotics could still be following the trend for more veterinary oversight. We need to continue to employ all the tools we have, whether it's treatment by injection, treatment by medication through the water, or treatment by medication through the feed. I also think that it's critical that these treatment decisions are being made in conjunction with veterinary consultation through the proper veterinary client-patient relationship, that producers are working with a veterinarian that is very familiar with their operation, that has regular visits and understands the health and the overall production practices of the farm. I think early on there were a lot of farmers that were very aggressive at pulling out antibiotics, and I think it was a good effort to see what was necessary and what wasn't necessary. Many of them discovered that those underlying health challenges that they had been using the antibiotics for previously for treatment were still there. One of the things that we've identified is that farmers and our customers have today become more interested in disease elimination. And so Mycoplasma hound pneumonia at the sow farm level has been one that we've seen an increased amount of interest in. Farms that are Mycoplasma hound pneumonia positive tend to have more challenges in the growing pigs that were produced from that sow farm, and that requires more antibiotics in late finish. So when they compare their antibiotic usage to other farms, they see that they're using more drugs, and so one of the solutions has been, well, let's go back and eliminate that disease from the sow farm. We think it's going to improve the health of the pig. We think it's going to be more profitable for the producer, and we think there will be a resulting decrease in the amount of antibiotic use.
Now, a few years ago, you and your colleagues introduced a program called the Pipestone Antibiotic Resistance Tracker, PART, I think is what you call it.
Yes.
How is that going, and what kind of impact is it having?
In January 1 of 2017, we implemented or introduced a program to our customers called PART. And it's what PART really is it's a surveillance program. And we're doing surveillance on resistance, as we discussed earlier. And then we're also providing a platform for those farmers to monitor and track their antibiotic usage over time. And so we think that today this is the only program that we're aware of that provides that service to independent farmers. And so that program has been successful to this point. We've been collecting data now for about 2.5 years, and we're able to benchmark or allow these farmers that are in the program to benchmark their usage with other farmers, which is a value. And then it's also increased and improved the conversations between the farmer and their veterinarian about their antibiotic usage. And so every 3 months, the farm veterinarian reviews the producer's antibiotic usage and submits a report or comments to the producer. And then at least once a year, there's a formal in-person review of all of their data with the farmer and the veterinarian. And so those conversations have led to more discussions about pathogen elimination, alternatives to antibiotics, increasing use of vaccines, et cetera. We think that's been a big success.
So when we talk about benchmarking, is it strictly quantitative, where you're looking at it and looking at how many pounds or grams of a particular antibiotic have been used in these herds over the last 2.5 years, for example? Or does that kind of set the stage for a more qualitative analysis?
We measure by grams of antibiotic per pig on a monthly basis, and we can track how the antibiotics were delivered. So we can break out antibiotics through the feed, antibiotics delivered in the water, antibiotics delivered by injection. We can track it down to the individual drug level, so we know exactly what antibiotics were used in what amounts. And then we also track and benchmark usage by the relative importance to human medicine. And so we use the FDA criteria looking at critically important, highly important, or important. And so there's a lot of discussions about how are we delivering the medications, which products are we delivering, and what's the relative importance to human medicine.
And how have the producers responded to this program?
I've been impressed at the rate of participation and the commitment that these farmers have towards tracking use and doing surveillance on resistance as part of the greater good. All of these folks have families. They are just like you and me, and they want to be able to preserve the effectiveness of antibiotics, not only to treat their livestock, but also their family members.